Zamfara State Commissioner for Local Government donates over 100 bags of rice to COVID-19 committee. Buhari's Chief of Staff Abba Kyari dies of COVID-19. Governor Masari of Katsina State suspends weekly market, Ramadan Tafsir, Taraweeh and Jumu'at prayers. On business, Naira drops to 387.65 per dollar as crude oil prices plunge to $27. And on the international scene, UK extends lockdown by 3 weeks. Welcome to Standard Voice Television News. My name is Samira Ibrahim. Now the news in full. Nigerians have been called upon to support the 3 tiers of government in the ongoing struggle against the spread of the coronavirus COVID-19 in the country. This they could do by obeying the directives of lockdown and other orders from the constituted authorities. The Zamfara State Commissioner for Local Government and Rural Development, Alhaji Yahya Chadugora, made the call while presenting 100 bags of rice to the State Task Force Committee on Prevention and Control of COVID-19 in the state. The Zamfara State Controller, Nigeria Correctional Service Zamfara State Command, Alhaji Salih Patiskum, says about 22 inmates in the state are to be granted amnesty by the federal government and state government. The controller disclosed this during a speech to inmates granted amnesty at Ministry of Justice in Gusau, the state capital. He said, amidst COVID-19 in the country, federal government directed all custodian centers to be decongested to avoid spread of the virus. In his speech, Governor Bello Mohammed Matawali, who was represented by Commissioner of Justice Barrister Noura Ibrahim Zarumi, said state government has planned to pardon over 50 inmates next week by God's willing. The governor also urged the inmates granted amnesty to be good people and give them transport fare to meet their families. The Zamfara State Commissioner of Health, Alhaji Yahya Mohammed Kanuma, has described as false the information that there is a case of coronavirus in the state. He said the statement is baseless, which is spread by some unpatriotic elements who want to panic people of the state. The commissioner therefore called on the general public to remain calm and continue to pray for God's intervention on the dreaded disease. Alhaji Yahya Muhammad Kanuma also appreciated journalists for providing all necessary information regarding coronavirus in the state. President Muhammadu Buhari's Chief of Staff, Abba Kyari, has passed on. Kyari tested positive for COVID-19 in March. The presidency confirmed the death in a statement issued by Mr. Femi Adesina, the spokesman of President Muhammadu Buhari. The presidency regrets to announce the passage of the Chief of Staff to the President, Malam Abba Kyari. The disease had tested positive to the ravaging COVID-19 and had been receiving treatment, but he died on Friday, April 17, 2020. The news broke in March that Abba Kyari had tested positive for the virus, while his principal Buhari was said to be negative. The presidency later released a statement confirming the report. President Muhammadu Buhari, Vice President Yemi Osinbajo, many governors, ministers and other top government functionaries had mingled with Kyari shortly before he tested positive for the coronavirus COVID-19. Kyari, who returned to Nigeria from Germany on March 14th, had participated in several staff functions and unofficial engagement that attracted prominent personalities. Kyari was flown to Lagos in an air ambulance to continue his treatment after testing positive for the virus. Kyari said in a letter that he made his personal care arrangements to avoid further burdening the public health system, which faces so many pressures. Nigeria on Friday reported 51 new cases of coronavirus, taking the total confirmed cases in the most populous black nation to 493. 159 patients have been successfully treated and discharged, while 17 deaths have been recorded since the outbreak of the virus in Nigeria, according to Nigeria Center for Disease Control and CDC. At least 14 persons were killed in a fire incident at a camp for displaced persons (IDPs) in Borno State. residents of the camp and similar ones in Borno were displaced from their homes by the Boko Haram insurgency, which has caused tens of thousands of deaths. The casualty figure from the fire was announced in a statement by presidential spokesperson Garba Shehu Thursday evening. Mr. Shehu said the fire occurred at an IDP camp in Ingala local government of Borno State. He said President Muhammadu Buhari Thursday evening described as extremely horrifying the news of the death of 14 persons and injury of many from the fire incident at an IDP camp in Ingala, Borno State. Reacting to the sad incident, President Muhammadu Buhari directed the Ministry of Humanitarian Affairs, Disaster Management and Social Development to investigate and report the circumstances leading to the incident and advise on how a future occurrence will be averted. 2 days earlier, on Tuesday, there was a fire incident at an IDP camp in Mafa local government area of Borno State. Mafa and Igala are separate local government in Borno State. Premium Times reported how no fewer than 700 shelters were destroyed by fire at the IDP camp in Mafa local government area of Borno State. The Secretary of the local government, Muhammad Lawal Sharif, provided information on the incident to the news agency of Nigeria, NAN, on Tuesday in Maiduguri. Mr. Lawal Sharif said that dozens of households in the camp were displaced during the fire outbreak, which started at about 11 a.m. on Tuesday and lasted for several hours. He said the fire incident, which began from a tent, gutted other shelters because there was no immediate fire service response in the camps at the time of the incident. He said the combined effort of the IDPs, civilian joint task force, security agencies and other good Samaritans brought the situation under control. The news agency of Nigeria, NAN, reports that the governor went to the operation headquarters on receipt of the information of the recovery of the firearms. Borno Senator Mohammed Ndume on Wednesday accused the Federal Government Relief Committee on COVID-19 headed by the Minister of Humanitarian Affairs, Disaster Management and Social Development, Hajia Sadia Umar Farouk, of fraud and called for its immediate disbandment. Mr. Ndume said the committee lacked credibility to manage the huge resources at its disposal. Mr. Ndume, who spoke to journalists during a press conference in his Maiduguri home, claimed the minister and committee members had failed to discharge the tax assigned to it in a transparent and equitable manner. The senator further said so far, distribution of the relief materials have been laced with fraud. The minister, who spoke on TVC, however, denied the allegation of bias, saying the committee was not solely about COVID-19. Mr. Ndume, who represents Southern Senatorial District of Borno State at the Senate, warned that unless President Muhammadu Buhari wants to squander what remains of his goodwill, he should not allow the committee to continue the disbursement of the palliative that was meant to reach the poorest of the poor Nigerians. Mr. Ndume said that he was disappointed that President Muhammadu Buhari did not announce the disbandment of the committee during his last national broadcast, despite the outcry of many Nigerians who expressed dissatisfaction about the ministers-led committee. The senator said he was not trying to make allegations against the Minister of Humanitarian Affairs, Disaster Management and Social Development. What he is saying are facts. The governor of Katsina State, Alhaji Aminu Bello Masari, has directed for the lockdown of the entire Dutse-Ma local government area with effect from 7 a.m. of Friday, 17th April 2020. Governor Aminu Bello Masari gave the order during the regular review meeting on COVID-19, which was held at the council chamber of the General Muhammadu Buhari House, Katsina. The governor revealed that a report from the National Center for Disease Control (NCDC) has confirmed one COVID-19 case in Dutse-Ma town, which made it necessary to lock down the local government area to tame its spread to other parts of the area and the state as a whole. Alhaji Aminu Bello Masari said other decisions taken during the meeting, which was attended by the members of the State Security Council, the State COVID-19 Emergency Response Committee, the Technical Committee on COVID-19, traditional and religious leaders. The decisions include shutting down of major weekly markets across the state, namely Maiduwa, Mashi, Charanci, Jibiya, Dutsen, Batsari, Kafur, Sheme, Dandumi, Zango, Danja, Bakon, Raita, Kagadama, and Dankama markets with effect from Friday, 17th April 2020. Other measures are suspension of weekly Friday congregational prayers at Jumu'at mosques in the state with effect from next week. Suspension of annual Ramadan public tafsir and Taraweeh prayers at mosques and all other centers and public places throughout the state, and suspension of activities at cinema, event and TV viewing centers. The governor has further directed security agents to ensure strict compliance with the restriction of movement of persons coming in through all interstate borders of Katsina State. All restrictions must be observed from the effective date until further notice. The Nigerian Maritime Administration and Safety Agency (NIMASA) has extended the validity of statutory and trading certificate for all Nigerian registered vessels. They include Standard of Training, Certification, and Watchkeeping (STCW) certificates for seafarers issued by the agency. The Director General of NIMASA, Dr. Bashir Jamu, who made this known at the agency's headquarters in Lagos, said the move was necessary to ensure uninterrupted shipping despite the pandemic, stressing that shipping is one of the major ways of moving medical aid across the globe. Dr. Jamu assured of their determination to ensure that shipping continues during this trying time remains unwavering, and this is why we have continued to come up with measures to keep the global shipping chain moving in line with the recommendations of the International Maritime Organization (IMO). He said the agency was aware of the difficulties seafarers will be facing and the need to keep them in job even beyond the pandemic, saying this has necessitated the agency's publication of a notice to extend their certificates and other statutory certificates that will ensure uninterrupted shipping. Muhammad Atiku Abubakar, a son of Nigeria's former vice president, has continued to test positive for coronavirus 4 weeks after he was confirmed, Premium Times has learned. He remained isolated without symptoms, a development that has surprised medical experts. Mr. Atiku Abubakar, 31, tested positive for the virus on March 19th. He was subsequently moved to the University of Abuja Teaching Hospital, where most COVID-19 cases around the Nigerian capital are treated. Despite being placed on medication including antiretroviral and immune-boosting vitamins, he has continued to test positive 28 days on, according to medical officials familiar with his case. He tested positive again on Tuesday. An official told Premium Times, saying that they are doing all that is in their power to ensure his recovery, but he can only be released after he has been deemed completely recovered. Another official told Premium Times, Mr. Atiku Abubakar's unique condition has puzzled experts at the NCDC. The official added that they have been saying that this is a unique condition, but we are confident he will recover soon. Mr. Atiku Abubakar remained asymptomatic even 1 month after he caught the virus. Both officials spoke with Premium Times under anonymity because the NCDC does not comment on individual cases unless otherwise determined by its top management. We'll be right back after this short commercial break. Stay tuned.
What is the novel coronavirus? When viewed under a microscope, coronaviruses can be seen to have a fringe, giving the appearance of a crown or a solar corona. The 2019 novel coronavirus can cause pneumonia in those who are infected, beginning with an elevated body temperature, fatigue, and dry coughing. This may lead to difficulty breathing and in some cases death. Currently, there is no effective cure for this. Compared to more familiar flu viruses, the novel coronavirus has a notably long period of incubation. It can take up to 2 weeks before a patient shows signs of infection. The coronavirus is typically spread through droplets of saliva in the air from sneezing and coughing, especially when an infected individual is in close proximity to others. In light of this, it's important to keep others at a distance and avoid crowded places to prevent infection. How can I prevent infection outside? When traveling distances, prioritize walking, bicycling, motorcycling, or taking your personal car. When taking public transportation, be sure to wear a mask. When in the workplace, keep a distance of 1.5 meters from anybody you must speak with. Avoid any meetings or gatherings in small, confined spaces. When eating at the same time as others, remember to keep your distance. Don't talk while eating. When shopping at places like supermarkets and shopping malls, try to go when less people are likely to be out. Try to avoid getting close to others. There will be more time for closeness in the future. What should I do if I'm showing signs of infection? If you're showing possible symptoms, such as coughing or elevated body temperature, don't panic. Let's compare pneumonia brought about by the novel coronavirus to a cold and a flu. A cold is often caught in cold weather or as a result of exhaustion. Common cold symptoms include a stuffy nose, a runny nose, and sneezing. Full body symptoms are usually minor. A typical flu is caused by a common flu virus and can lead to respiratory tract infection. In addition to upper respiratory tract issues, those infected can also develop pneumonia. A flu is often accompanied by an elevated body temperature, headaches, muscle fatigue, and a loss of appetite. For those infected by the novel coronavirus, light symptoms will include elevated body temperature, coughing, and cold flashes, while the strongest symptom is having difficulty breathing, sometimes causing death. If your temperature exceeds 38 degrees and is accompanied by coughing or other symptoms, it's extremely important you get to a hospital to be checked to ensure that you are not infected and that you don't infect others. How can I prevent infection at home? First, you should limit how often you go outside and stay away from any crowded places. If you must go out, you should wear a face mask to help you prevent breathing in any particles containing the virus. Upon returning home, the first thing you should do is wash your hands. Wash with soap and water for at least 20 seconds. Also, keep your home clean. Open windows and disinfect surfaces at a fixed time. Your immune system is vital. Be sure to get enough sleep, eat healthy, and exercise. These things will boost your immune system and help you if you should need to fight off the virus.
Welcome back. On business, over to Jemima Samuel.
Welcome to Business Update. Nigeria's Naira is expected to have little price swings in the coming weeks as the federal government's lockdown of Lagos and other parts of the country continues to aggravate dollar shortages. The Naira traded at 387.65 Naira per dollar in the over-counter of OTC markets on Thursday due to the poor market liquidity. It has softened to an intraday low of 388 Naira on the official market in the previous session but later rebounded. Meanwhile, U.S. crude oil was below the $20 level, closing at $19.87 a barrel on Thursday, while Brent crude oil closed at $27.82 a barrel, falling below Nigeria's adjusted benchmark for crude oil perched at $30, thereby reducing the dollar earning for Nigeria. Crude oil marks about 90% of Nigeria's export earnings. On Monday, Nigeria's authority extended the lockdown of Lagos, Ogun, and Abuja by 14 more days. The lockdown is aimed at curbing the spread of coronavirus in Nigeria. Although well-intended, the lockdown is seriously affecting the country's economy. In the meantime, the Central Bank of Nigeria now rendering shelter service even as currency traders work from home, yet dollar shortage have worsened. Recall that in mid-March 2020, Nigeria's Apex Bank postponed forex sales to retail currency traders, bureau de change operators, and after the federal government banned entry to nationals from 13 countries with over 1,000 COVID-19 cases. Nigerians were also advised to cancel or reschedule their any planned travel to other countries. The American dollar index surged on Thursday, closing at $100.130 as investors rushed to safety following series of negative data. And that's what we have on Business Desk today. I'm Jemima Samuel. Thanks for watching.
And on the international scene, Imam wearing a protective face mask takes a selfie on London Bridge on March 21, 2020, on the day that UK region traditionally desperate for tourists pleaded for people not to visit the coast or the countryside for fear of spreading the coronavirus. Britain will extend its coronavirus lockdown for at least another 3 weeks, Foreign Secretary Dominic Raab said on Thursday, as hundreds across the country continue to die daily from the outbreak. The government had decided that the current measures must remain in place for at least the next 3 weeks, said Raab, who is standing in for Prime Minister Boris Johnson, who is recovering from the virus. Still on the international scene, US President Donald Trump has said border control and travel restrictions will be top priority as the country prefers to reopen its economy after a costly coronavirus shutdown. Trump said during his daily news briefing on COVID-19 at the White House on Thursday, where he announced a 3-phase plan for the reopening process. Trump said as they begin a science-based reopening, they must be extra vigilant in blocking the foreign entry of the virus from abroad. He said border control, travel restrictions, and other limitations on entry are more important than never before to keep the virus in check and allow Americans to get back to work. Certain experts advised the president said the pandemic curve had flattened and the peak in new cases behind, hence the need for Americans to start our lives again. However, he said the state will decide on when to reopen, but the guidelines recommend criteria that will have to be met in this regard. Based on the latest data, their team of experts agreed that they can start the next front in their war, which they are calling opening of America again. Trump said that a prolonged shutdown combined with a forced economic depression could deeply hurt the country and its economy. One of the key recommendations for the first phase is the avoidance of groups of more than 10 people where appropriate social distancing is impossible. The first phase also discourages non-essential travel and encourages telework, working from home, and closure of common areas and offices. Also recommended in the need for states to achieve a 14-day downward trajectory in coronavirus before beginning the reopening process. Under the plan, states are expected to set up screening and testing centers in addition to develop contact tracing capabilities. It also recommends that hospitals should be a robust system program in place for healthcare workers, among others. While acknowledging that there will be challenges ahead, Trump said the goal was to quickly identify and address new cases. That has been the news from Standard Voice Television. To end the news, a quick look at the major headlines. Zamfara State Commissioner for Local Government donate over 100 bags of rice to COVID-19 committee. Buhari's chief of staff Abba Kyari dies of COVID-19. Governor Masari of Katsina State suspends weekly markets, Ramadan Tafsir, Tarawih and Jum'at prayers. On business, Naira drops to 387.65 per dollar as crude oil prices plunged to $27. And on the international scene, UK extends lockdown by 3 weeks. That's the news. On behalf of the production crew, Head of News and Current Affairs Department, Alhaji Ibrahim Kabatan, I'm Samir Ibrahim, wishing you a pleasant weekend. Keep watching Standard Voice Television. Goodbye.